Hi guys, welcome back to Dr. Gilead Show. Today is May 18th, 2017. We are on Dr. Gilead Show, WBGR Radio, and also on Facebook Live. I'm Dr. Theo Oswala, your host. Today we're going to talk about caffeine-related disorders. Caffeine which we all drink from coffee every day. So I want to welcome you back today. You can call on 301-429-9247, 301-429-9247 on WBGR Radio, or you can also connect to us on Facebook Live. So if you have any questions or any contributions, you can send contributions to our Facebook page. You can also call on WBGR Radio 301-429-9247. Before we start, we always like to say, if you have any medical problems or any desires to see someone, it's always good to call and see a trained personnel. Do not use what you hear on this platform to make a diagnosis of yourself or on someone else. Dr. Gilead Show, the producers, as well as the hosts, cannot be held responsible for what anyone does based on what they hear on this show. But today is a great one. We're talking about caffeine-related disorders. Caffeine-related disorders. Caffeine is a part of, it belongs to a group of compounds called xanthines, and is an alkaloid. It's found in coffee or tea leaves. It is very common and is found everywhere. Is a central nervous system stimulant like cocaine or PCP or amphetamines. So it is one of those stimulants that we have to be very watchful about. But the thing is, everyone uses it. Everyone drinks coffee. Everyone drinks tea. And so we don't really know the details of what harm this particular agents can do to people. Caffeine is found in most beverages like coffee, tea, cocoa beverages, even cola drinks, as well as in a lot of over-the-counter medications. Caffeine contents in regular foods and some medications sometimes could be quite high, and because we drink it, we do not even know how much of caffeine we are taking when we are taking these beverages. For example, an 8-ounce cup of coffee contains about 135 to 150 milligrams of coffee. That is huge. And a lot of people drink coffee every day, but they don't know how much of what they're drinking. The regular cappuccino, which we drink, 8-ounce cup, contains about 60 milligrams of coffee. The tea, the regular tea, contains about 50 milligrams of caffeine. The drinks, the sodas, Mountain Dew contains about 38 milligrams of caffeine, which is huge. And that's why when people drink coffee or drink soda like Mountain Dew, they have a lot of effects. For example, even coffee ice cream, I know many of us take coffee ice cream, that contains a huge amount of caffeine, 85 milligrams of caffeine. Even our dark chocolate candy, the candy bar that we give our children, that contains about 31 milligrams of caffeine. And some of the over-the-counter medications we drink when we're trying to stay awake, night shift workers, if you run the late night schedule, the no dose, that the regular no dose contains about 100 milligrams of caffeine, while the maximum strength dose is about 200 milligrams of caffeine. That is huge. That is a whopping dose of caffeine to take at one point. The regular Excedrin contains about 130 milligrams of caffeine. And the energy drinks, That is another huge one. The Monster regular drink contains about 160 milligrams of caffeine, while the Mega Monster contains 240 milligrams of caffeine. That is unbelievable. That is huge. So you have to know what you're really drinking. The Red Bull contains a whole lot, 111 milligrams of caffeine. That is huge. When people drink that, that's why when people drink that, they have all kinds of effects. I remember many years ago, as a resident at Maryland, University of Maryland Medical Center, when you go in on call Friday night, you don't get out until Monday evening. So at a point, you're running on coffee. But one of those days, someone gave me a Monster, and I took it. I was moving. All the sleep was gone. But the next day when I took it, I almost had a heart attack. My blood pressure shot up to 180 over 110 just on a can of Monster drink. The caffeine content is unbelievably high, 240 milligrams of caffeine. And this is so important because recently a 16-year-old died of coffee intoxication. A 16-year-old had a huge amount of coffee over a short period of time, and he died. So that's why this topic today is very important. So we have to take it very seriously. But what is the prevalence? How often do people drink coffee? Approximately 85% of adults and children in the U.S. consume caffeine and caffeine-related drinks and beverages. 85%. That is unbelievably high. But also it cuts across the whole world. Now, the adult caffeine consumers take about 280 milligrams of caffeine per day. 280 milligrams of caffeine a day, an adult that uses caffeine. And it's estimated that about 10 to 12 billion pounds of coffee is used every year worldwide. That is an unbelievably high amount of caffeine that is consumed by people all over the world. Now, caffeine is defined as the most widely used psychoactive substance in the world. It is the highest or the most common stimulant that is used all over the world. And the problem is it is legal. So caffeine use and the problems from caffeine is very common, but we do not see it as an addiction. As a matter of fact, the DSM, the Diagnostic and Statistical Manual, Volume 5, which is the manual that psychiatrists use in determining diagnosis of mental health, clearly marked out disorders that can occur from caffeine. And number one is caffeine intoxication. Also, we have caffeine withdrawal and also other caffeine-induced disorders. Now, one thing we do not see, one problem is we do not see it as an addiction because caffeine-containing food as well as drinks are not regulated. It's all over the place. People do not really know the amount of caffeine they consume. So we don't know how much caffeine we consume in the things we eat every day. Also, because caffeine-containing food is not regulated anywhere in the world, it has a legitimate use because it is sometimes added in medications. So we have aspirin that has caffeine added to it. Sometimes acetaminophen or Tylenol that also has some caffeine added in it for tension headaches, and sometimes it helps the medication work faster. Also, I think people, we do not see it as an addictive substance because it has less tendency to produce the amount of intoxication or dependence as other drugs that people abuse. So what am I saying? Caffeine is generally available. It is in foods and beverages that are not regulated, so we can eat as much as we want to, We can drink as much as we want to, but it's good to know that people can die. People can have problems from consuming a lot of caffeine. So this is why this particular topic is very important, and it would be good for people to really listen. And you can also review it on our Facebook page. You can also look at it on Dr. Gilead's show on YouTube. These things are all uploaded on YouTube. You can take a look. So caffeine can cause a whole lot of problems. It will be good for everyone to reconsider how much caffeine they drink, or how much caffeine they containing products that they eat. Now, how does caffeine work? What is the mechanism of action when you eat ice cream, coffee ice cream, or you drink Mountain Dew, or even you drink regular coffee? What happens is when you take any of these beverages, it is quickly absorbed through the gastrointestinal tract. It goes through the stomach, through the small intestine, and it's absorbed into the bloodstream. Caffeine is not metabolized, it's not broken down, so it's absorbed the same way you took it. It's not broken down, and it goes straight to the brain. The question is, what does it do to the brain? What does it do to the central nervous system? Once caffeine hits the central nervous system, it immediately causes release of one of those chemicals we talked about, the neurotransmitter, norepinephrine. We all know norepinephrine. Norepinephrine, that is the neurotransmitter, or the chemical that modulates, that brings about the flight or fight response. The flight or fight response. When norepinephrine is released in your body, you get very active. People can take off running. People get more protective of themselves, because it is a protective neurotransmitter. It's a protective chemical in our brains. So this chemical, once it is released, it increases the activity of the nerve cells in the brain. Once it hits the sleep center, the reticular activating system, this is a center in the brain that when it's activated, you stay awake. Then when it's suppressed, you go to sleep. So caffeine goes to this center, to the brain, as a matter of fact, and it releases epinephrine, norepinephrine, and norepinephrine stimulates this center, and you can stay awake as long as possible. So this is probably why a lot of people take caffeine containing products, and because they want to stay awake, or because they're tired, they want to be active and alert. And this is the reason why caffeine, we must be very careful how much caffeine we take, because sometimes it could be toxic. We're going to look into some of the symptoms of caffeine intoxication as it is defined in the DSM, the Diagnostic and Statistical Manual of Mental Illness, the DSM-5. Now, someone takes a consumption of about 250 milligrams of caffeine. If this occurs, now when this happens, when you take that amount, or shortly after, any of these symptoms that I'm about to list will begin to happen due to the effect of caffeine in the brain. Number one symptom of caffeine intoxication is restlessness. The person is totally restless. They can't sit still. They are, sometimes they fidget, they're touching things, they're all over the place. They cannot calm down. And sometimes they're so restless, people say, man, what you smoking? What you doing? But it's just because they've taken such amount of caffeinated beverage or food that they can't hold themselves together anymore. They're trying to stay up, they're trying to stay awake and alert, but the amount of caffeine in what they've taken is so much that they become intoxicated and they're so restless. But because caffeine is not illegal, you can take as much as you want, people do not regulate how much they take. As a matter of fact, some people do not even know how much caffeine they're taking. That is a major problem. So the people are so restless. Number two, in caffeine intoxication, people become very nervous. They're anxious, they're nervous, they're acting like they have panic attacks. Sometimes it's so hard to calm themselves down. You see, they take a walk, they get out, they want to take some fresh air, or they go by the air conditioner because they're so nervous, they're sweating. Sometimes there's so much excitement. They become talkative, too happy, just like any other stimulant would do. The effect of any other stimulant on the normal brain is what exactly caffeine does. So they're restless, they're nervous, there's so much excitement. Number four, it also causes insomnia, difficulty sleeping. And I have had some patients come to me and they say, hey doc, I don't sleep. I go to bed and I'm up till 3 a.m. And when I take a detailed history, I find out most times that they're drinking coffee up until 9 p.m. Or they're out, they get some food, then they eat some coffee ice cream. That will keep you awake, depending on how much caffeine content in what you just took, or how much coffee or caffeine containing beverages you've been taking in the past. If you've always been taking caffeinated drink, it wouldn't have too much effect. But if you take it once in a while, or you're taking a huge amount in a very short time period, it's going to keep you awake all night. And for some of my patients, what I have done is just to say, okay, after your morning coffee, do not take any more coffee after 12 midday. And they come back to me after 2 weeks and they're sleeping. Even though they go through some withdrawal, we're going to look into that. We're going to look into the caffeine withdrawal symptoms, but that could happen. But at the end of the day, they're sleeping well again. The other symptom of caffeine intoxication is flushed face. This is seen commonly in Caucasian or light-skinned people because caffeine causes dilatation of the blood vessels on the face and the whole body. So more blood flows to that area and their face is flushed. They look so red because of the effect of the caffeine. Now also, when people have caffeine intoxication, they have increased urination, diuresis. They pass urine frequently. This is because caffeine is not broken down. It's a solid substance, and once it gets through the kidneys, it attracts more urine to it, and the person goes to the bathroom frequently. Also because it also increases, dilates the blood vessels, more blood flows through the kidneys, and more fluid is taken out. So people could get dehydrated. And that's why when people drink a lot of coffee, you find them drinking water because they're so thirsty, because they're peeing a lot as well. In caffeine intoxication, they could also have gastrointestinal disturbances. And this could come as simple abdominal pain, cramping. In worst cases, in severe intoxication, they could have diarrhea, and which could be more problematic. So when people who drink a lot of coffee present with these symptoms, the healthcare provider, the ER physician must look into what actually they're taking. You need to get good history, find out what substances they are taking. It may not be anything major, it may just be simple caffeine intoxication. When people are intoxicated with caffeine, they also have muscle twitching. And when people come to my office, I look at them, they're hyperactive, they're talkative, they're restless. You could look at them, some may have twitching of the muscles of the face, twitching around the eyes, and they're rambling. The first thing to think about is this person taking too much caffeine? Sometimes they have rambling flow of thoughts and speech, so their speech is fast and sometimes difficult to slow down, difficult to stop. They just talk a lot and talk real fast. Why do they talk fast? Because their thoughts are moving so fast, so they are speaking to catch up with the rate their thoughts are going. So they're talking fast to catch up with the rates their thoughts are going. The thoughts is moving so fast, so they try to talk fast to catch up with it. The other symptoms of caffeine intoxication are tachycardia, increased heart rate. Like I told you, when I took the Monster, my heart rate was 120 per minute, when actually my heart rate usually, because I exercise, is in the upper 60s, 65, 64 sometimes. But with the Monster, my heart rate went up to 120, and it was beating so fast. That is a sign of caffeine intoxication. Also, people have cardiac arrhythmias. The heart rate is beating so fast, and it's out of rhythm. Instead of beating at a regular rate and rhythm which it beats, it goes out of rhythm, and sometimes that could be problematic. When the heart is beating out of rhythm, the heart does not push out all the blood that comes into it, and you could have a blood clot forming there, which could be dislodged, and is lodged in the brain or in the heart, and you get a stroke or even a heart attack. So this is the, one major problem that could happen when people have caffeine intoxication. The other symptoms of caffeine intoxication are they have periods of inaccessibility. They feel so on top of the wall. They are inexhaustible. They keep going. And that's why you see someone who has taken too much coffee, they are on the move all the time. They cannot stop. They're just moving all the time. They don't want to stop. They can't slow down. They can't get some rest. They also have psychomotor agitation. They're so agitated, they are on the move because their brain is moving so fast. It's worthy to know that in very high doses, people could have ringing in the ears, some form of tinnitus. They hear sounds, high-pitched sounds, ringing in the ears. So for healthcare providers, when a patient comes to you and they're complaining of ringing in the ears, it's always good to get a good history of substance abuse, especially caffeine, because it's something that a lot of people use. So they have ringing in the ears. Sometimes people have complained of seeing flashes of light. They see flashes of light, like starry lights that way. And that is a telltale sign of caffeine intoxication. Others will have profuse sweating. They sweat so much. And some will have diarrhea, severe bouts of diarrhea. And in very extreme cases, very high doses of caffeine, above 250 milligrams, people have had seizures. And at the extreme case, people have died. And recently, we heard about a young 16-year-old man who died of caffeine intoxication. He died because he took too much coffee in a very short period of time. And I really don't know the details, but I could imagine that this boy is not a regular coffee drinker. So his body has not developed tolerance to the amount of coffee he took. So he took too much at a very short period of time. And from all that I have described, you can see that he may have had either a stroke a seizure or a heart attack from severe increase in blood pressure, severe increase in heart rate palpitations, and possibly cardiac arrhythmia, which any of these will cause a heart attack and could also cause a stroke, which could lead to death. So it is very important, it's good to know some of these symptoms so that you can know and prevent any deaths or any complications that could arise. It is also said that 7% of people may experience 5 or more of these symptoms, along with functional impairment, and that is people take coffee so they can go to work, so they can stay active, so they can stay alert and work. But at the end of the day, because of the severe side effects, they're impaired. They cannot work anymore. They can get so intoxicated. And this is classical. So we have to know that these symptoms could occur with any amount of coffee you drink, depending on how much coffee you took and how fast it was taken. I see Candice. Thank you for tuning in at this time. And also Michael Peel, thank you. Fola, thank you for joining. Here is a question before we go on break. You say, hi doctor, what are your thoughts on other ingredients of energy drinks that have stimulating effects other than caffeine, like taurine, ginseng, ginkgo biloba, guarana? Is this worse than caffeine? Good question here. So, the thing is, these ingredients may have their own effects on the brain, but caffeine on its own is a very severe stimulant, and we know that it can cause palpitations, arrhythmias, severe increase in blood pressure, as well as tachycardia, and it could cause these problems, which could be a bigger issue. But things like taurine, ginseng, ginkgo biloba, and guarana are additives to energy drinks. At the long run, they may have their major side effects that they can cause on human central nervous system, but these are areas things that need to be researched into, and I think I might have to check them out. So when I come on the show next time, because this series we're still talking about addictions and substance abuse, I might have to talk about it based on my findings when I come on the show again. But today, the caffeine content of these energy drinks are so high, such that when it's mixed up with these other additives, we can have more problem like we're seeing here. At this point, we're going to take a break. Don't go away. Stay with me. We are on Dr. Gilead's show talking about caffeine-related disorders. Don't go away. We'll be back shortly.
You want me to open the door?
We'd like to be able to let you know that we're looking for you to come and share with us preaching every Sunday. Our motto is the church where Christ and community connect. We got a host of programs all year round. You don't want to miss out on that church each Sunday starting at 9:20 in the morning to 11 o'clock service. All kinds of music ministry that will delight you. You need to come hear some of this. Preaching, I can't say it, it's indescribable. The revelation of the Lord moves now. That's why I'm doing the feast Sunday morning, 11 o'clock. We got biblical student lunch. We got memory classes from marriage, singleness, dealing with grief, dealing with learning how to live a life. Many, many more. Why don't you call us 202-329-5991? I want you to know, listen to our nation. God knows you.
All right, guys, come back. Welcome back to Dr. Gilead's show. I'm happy you stayed tuned. And Michael, thank you for tuning in. Fola, thank you. Also, Candice. These are all people, these are healthcare providers that are tuning in from different places. Today we're talking about caffeine related disorders. We are on Facebook Live and we are on WBGR Radio. You can call on 301-429-9247, 301-429-9247 if you have a contribution, or you can send us a message on our Facebook page or questions that we can answer, like Michael just did. All right, now let's move to the next disorder, which is caffeine withdrawal. In DSM-5, caffeine intoxication and caffeine withdrawal are the two major disorders that are listed. Caffeine withdrawal. Now, this happens with abrupt cessation. When you drink coffee a whole lot over a long period of time and you stop abruptly, you can have caffeine withdrawal. Or even a reduction in the amount of caffeine you use could happen. This could happen within 24 hours of stopping the caffeine drink. Now, people could have some signs and symptoms. The commonest of them all in caffeine withdrawal is headaches. Now, the headache could be diffuse, that's it could be all over the head. It could be unilateral, which means it could be on one side. It could be, a lot of people talk about throbbing headache at the back. So it could be throbbing. Sometimes it could start gradually. But a lot of the times when people have this headache from caffeine withdrawal, it is so traumatizing. It's a pain and they cannot function. Sometimes they are sensitive to movement, so they prefer to sit in one place. Someone also came to my office and he talked about being very sensitive to light. So they try to stay in a darker place because light sends sensation into the eyes, and that could make the headache from caffeine withdrawal more intense. And my personal experience, which I like to share, 2 years ago, I used to drink quite a lot of coffee, and one day I was going through a lot of things. I was shaking, sweating, and I said, look, I think I'm drinking too much coffee. I need to quit. I need to stop. And it was a Thanksgiving Thursday. I did not have coffee all day, but it took me, it was a torture. It took me up to 2 months to really feel much better. The headache was so intense, but I knew what I was doing. I knew I was going through withdrawals. I stuck on. I hung in there because I knew that I would feel much better after some time. So what I'm telling you is my personal experience. I went through caffeine withdrawal. So the headache is very, very troubling. The other symptoms is marked fatigue. People feel so tired. They feel draggy, no energy to do anything, no drive. So they feel so fatigued. And that could be rightly so, because what happens is caffeine is giving you extra energy, keeping you active and alert. once you don't take coffee, what happens is your mood, your energy level drops below the normal because you've been operating at a higher level with caffeine in your bloodstream. So people have marked fatigue. People feel drowsy, a lot of drowsiness because, of course, it makes sense. You've been staying alert and active and awake with caffeine. But once the caffeine is withdrawn, you're going to feel very groggy, very drowsy. Also, because caffeine increases your mood, makes people feel good, once they stop drinking coffee or any caffeinated drink, they have a very dysphoric mood. They feel low, they feel sad, they feel unmotivated to do anything, they feel draggy. They don't even want to move. They don't feel motivated to go to work or to attend meetings. If even they are in meetings, they will not effectively contribute to what is going on in the meeting because their mood is so down and low. People sometimes feel so low that they present to the doctors with depressive symptoms. So they have depressed mood as well. They feel like they're going through depression. But when they go see their doctor and the doctor takes a look, takes a good history and evaluation and examination, they find out that they are withdrawing from caffeinated drinks or caffeinated beverages or food. The other symptoms of caffeine withdrawal is irritability. People become so irritable, so angry. Their frustration tolerance is very low. They can't take any frustration at all, any pressure at work or even at home. So they're irritable, they're sad, and that is very, very frustrating for them. It also causes difficulty concentrating. They have a hard time focusing because their alertness is gone, they can't focus. There is one of the major symptoms I had as a person was this flu-like syndrome. I thought I was having the flu, but I knew something. I knew this was probably because I quit drinking coffee. And people have this flu-like symptom, which includes nausea, you're feeling like you're going to throw up. Some people actually throw up. There's a general feeling of unwellness, what we call malaise. And there's muscle pain. Sometimes people have muscle stiffness. So you feel tense, muscle tightness. These are all withdrawal symptoms from caffeine withdrawal. The symptoms usually last, the very severe symptoms usually last 12 to 24 hours. Now, but sometimes, or most times it lasts 1 to 2 days, but it could last up to 2 to 9 days. But mine lasted more than that. But the average is about 21 days. Sometimes people have reported headaches lasting longer than that. But the irony is, if people are having these symptoms, once 30 minutes to 1 hour after taking caffeinated drink, all the symptoms disappear. So if you're having the symptoms and the withdrawal is so intense, a little drink of a caffeinated drink may change will change the symptoms immediately. But if you are determined to quit using caffeinated drink, you immediately will hang in there, you will hold on, it will come to pass, like I did. And at a point, I almost went back drinking coffee, but I knew what I was doing. I knew that at the end of the day, I would feel better. So I stayed on course and did not go back drinking coffee. Okay, I see Manny, Dr. Menike from Los Angeles. Thank you for joining. Manny is a pain physician in Los Angeles. He is also an internist and a pediatrician. He's triple boarded. So I know that you are enjoying this show today, caffeine intoxication, caffeine-related disorders. Now, let's look at adverse effects of caffeine use. people have reported caffeine-induced anxiety-like symptoms, caffeine-related anxiety disorders. These symptoms present exactly like clinical anxiety, feeling of nervousness and anxiousness. So people are so anxious, they're nervous, they have palpitations, the heart is beating so fast, they have tremors, they're shaking. When they write, their handwriting is so bad, you can, if you watch the person and look at the handwriting and their general behavior, you will know that this person is going through severe effect from caffeine drink. It's also been shown that caffeine drinks can affect your fertility, and that means the ability to have children. So which means it could affect the sperm count. It could also affect the ability of a female to conceive and have a child. So it affects fertility. So actually it could cause infertility. Also, caffeine has been associated with osteoporosis. Osteoporosis, that is low density of the bone. Your bones become brittle, not strong anymore. So little falls, the bones could fracture. This is this is common in older women once they have reached menopause, because the body begins to absorb calcium from the bones. If they don't have calcium replacement therapy, they have brittle bones. Caffeine will quicken this process. So if you are postmenopausal, it will be advised that you stay off caffeine and caffeine-related drinks. Also, it's been shown that pregnant women who consume a lot of caffeinated drinks could have miscarriages. They could lose their pregnancy. So if you are pregnant, it would be advisable not to do caffeinated drinks, and this would include caffeinated drinks like sodas, Mountain Dew, Pepsi, Coca-Cola, as well as caffeinated ice cream, coffee ice cream, and all those, as well as coffee and tea. There are so many other beverages we can drink to avoid these long-term side effects from taking caffeinated drinks. Also, it's been shown that children born of mothers that consumed a lot of caffeinated drinks have low birth weight. So the children are born with very low birth weight. The weight of the baby is grossly below the normal weight that a child should be when they are born. And of course, this could be because of hyperactivity from the caffeine. Caffeine causes a lot of hyperactivity, and it could affect the birth weight of the baby. There are other cardiovascular diseases that could occur when people are drinking a lot of coffee. We know, as we have said here already, that caffeinated drinks could cause increase in blood pressure, also palpitations, cardiac arrhythmias. The heart is beating out of rhythm. That could have a long-term effect. Now the question is, a lot of people drink coffee. How come they're not coming down with heart attacks or cardiovascular problems? The reason is people develop some amount of tolerance to the caffeine, so their body gets used to it, and some people do not drink every day. So they get used to it, and they don't have some of these long-term side effects. But it's worth watching if you are a regular coffee or caffeinated drink consumer. Long-term effects, other adverse effects are things like seizures. Seizures have been seen in people who drank a lot of coffee, especially large amounts of coffee or caffeinated drink in a very short time period. They could have seizures, and of course, in extreme case, people could die, like in a young man, the 16-year-old that died recently. So the question is, for someone who drinks a lot of coffee, how can they be treated? How can they get off it if they want to? First of all, the individual must have a good understanding of the effect of the caffeinated drink. So they must understand that with this caffeinated drink that I take every time, these are the complications that can come from it, and then they will be willing to stop. Once they are willing to stop, then then the doctors can work with them. It is important that we understand the risks that are involved in drinking these products. The key is to gradually lower your daily consumption. So once you determine that you want to stop drinking coffee or caffeinated drinks like Mountain Dew or Monster or Red Bull, do not stop cold turkey. Do not just cut up and stop. You're going to go through a lot of withdrawals. So the key is to gradually lower your daily consumption and gradually begin to abstain from these beverages that contain caffeine. And once you begin to do that, you may go through some little withdrawals. Some not bad enough to see a doctor, but some it is so intense that you may have to see a doctor. And I'll get to some of the things that the doctor can do to help you. It's also good to have a good patient education. Educate your patients, educate yourself, family members who are drinking a lot of coffee. Let them know these problems that can occur. And also, it's good to know the amount of caffeine in the beverages that we drink. Like I enumerated before, how much caffeine in the energy drinks, how much caffeine in an 8-ounce cup of coffee or cappuccino, which most of us do not even know that they contain they contain caffeine. Some people do not even know that tea, the regular tea that we drink, green tea or regular tea, contains a lot of caffeine. So once you educate family members or your patients about this, then they can slowly begin to cut back. Now, people can also substitute caffeinated drinks, caffeine-containing beverages with non-caffeine containing drinks. Sometimes it is just the drink, the good taste of the drink that makes people drink it. A doctor from Florida just sent me a message on Facebook, and he says, what about the good taste of coffee? Well, it tastes good, but the question is, what are the effects of this drink when you take it? We know that it has some severe effects. So what do you do? And how do you? What are the long-term effects of these drinks? So it's something to think about. The doctor says, but it tastes good, though, especially Starbucks. However, must be consumed in moderation. So the doctor from Florida, Dr. Soga, who is an internist in Florida, just sent a message. He says that it must be consumed in moderation. Before I continue, there are a few messages on our timeline. Another guy says, I make conscious efforts each day to reduce my intake. When your job involves thinking, those cups of Joe come in handy. However, I do switch it up with chai tea. So, this guy is switching between coffee and tea. Between coffee and tea. The question is, how much caffeine is contained in the tea that you drink? Maybe, most probably, a lower amount of caffeine in the Joe that you drink. So, it may be a good idea to switch a little bit and slowly cut back. But when you cut back and gradually quit, you will know that you can really function without the caffeinated drink. And that is Chuck from Baltimore. Thank you for these excellent contributions. And Fola, who is a nurse practitioner in Baltimore, says this has got to be the most common form of addiction. Absolutely. Caffeine is rated as the most common addictive stimulant worldwide. And we just said here that about 10 to 12 billion pounds of coffee are consumed each year worldwide. So it's not only in North America, across the globe, in Ethiopia, in Europe, in other parts of Asia, Africa, people drink coffee, so much coffee. And it is, that's why this topic is very important. So, in treating people who have addiction to coffee or who have caffeine-related disorders, it would be good to switch to decaffeinated drinks. We have decaffeinated sodas, we have decaffeinated coffee, but the most important drink is water. Once you cut out drinking caffeinated drinks, drink water and water and water. You'll never go wrong with drinking water. It is the most important, the safest drink ever. So if we do that, we can't go wrong any day, any time. But remember, you can have water intoxication if you drink a lot of water. So too much of everything is bad. All right, now family members, spouses, significant others, you can help support your family member when they want to quit drinking caffeinated drinks. Also, if your spouse is also a coffee drinker, it will be good to quit as well at the same time that your family member is quitting. Because if someone is quitting and the significant other in the house is also drinking, it is hard to quit. So we all must quit together. So you work together so you don't pull the other person down. During withdrawals, the headaches, simple analgesics like aspirin, ibuprofen, or Tylenol is just enough for the headaches and muscle spasms. So simple analgesics can help with the muscle spasms and the headaches. It's not too terrible, but if you have to take something, you can take a simple analgesic, and that will be helpful. Now, there have been very rare occasions where the withdrawal is so intense, and also, or the intoxication is so bad that doctors have to give a benzodiazepine. Benzodiazepine are simple medications like Ativan, lorazepam, or clonazepam, or alprazolam, Xanax. These medications are so addictive, and a lot of the times it is really, really not needed because they are addictive. You don't want to jump from one addiction to another. But if it is absolutely needed, doctors can prescribe very small dose of benzodiazepine for a very short period, and is taken as needed. So when people come in, caffeine intoxication, running like they have severe anxiety disorder, once the doctor gets a good diagnosis that this is the problem, the right thing to do is to calm the patient down. If there is need for some analgesic to take care of the headache, you do that. And if in extreme conditions, extreme situations, you can give a benzodiazepine, a very tiny dose of benzodiazepine, Librium, Ativan, 0.5 milligram, or even in severe conditions where there is insomnia, irritability, you can give low dose clonazepam, 0.5 milligram. That can tidy the person through the first few days when the withdrawal or intoxication is very severe, and that can help them feel much better. So these are the things that that the doctor can do. Now, if a patient is so intoxicated that they have things like seizure disorders or seizure from caffeine intoxication, they need to be in hospital. you need to call 911. You need to call for the emergency, for the ambulance to come, and the person will be taken to the hospital, to the emergency room, where they will be appropriately treated, IV fluids put on, and if need be intubated so they can get better, because death could happen, like the 16-year-old who died from caffeine intoxication. These are simple beverages that we take, we consume every day. They are legal, they are all over the place. There is no regulation on how much caffeine, how much soda a child could do. There's no age limit, like you're going to buy soda, they want your ID card to see how old you are before you can buy it. No, it's legal, people can take it, but we're learning here that it could cause severe intoxication, and people could have seizures, people could die, people could have a lot of cardiac problems, central nervous system problems, insomnia. So this is why we must watch out what our young ones do. I go to parties and I see young little children running around with Mountain Dew, Pepsi, Coke. And the thing is, once they take these drinks, they are hyperactive. They are running all over the place. They are so difficult to control. And in my office, in my clinic, parents have come with their children and they say, once they eat candy or once they eat chocolate, they become so difficult to control. If you remember, we talked about caffeine content of a chocolate bar. It is about 31%, 31 milligrams of caffeine in the chocolate that we eat. So that will tell you why, that can explain why your son, your daughter, who has ADD or even not attention deficit disorder, is so hyperactive after he takes a candy bar or a chocolate bar, because the caffeine content is so high. So parents, spouses, significant others, we must watch out, we must look out on what our young ones are eating, on what they are taking, what soda they're drinking. And even sometimes I see very young people drinking cappuccino, French vanilla cappuccino and all that, hot chocolate. Those contain very high amount of caffeine. So once you know that this is a problem, you will immediately advise your children on what they should or should not drink, because this could really make them hyperactive. This could affect their activity. This could affect their learning ability in school. Families, watch out for one another. If you think you are severely addicted to caffeine, energy drinks, whichever one, Red Bull, Monster, and you want to stop, you're going through severe withdrawals, you can call for help. There are helplines out there, and people can really support you, go through the withdrawals. But the protocol is to go slowly. If you're drinking a lot of energy drinks, you can step down to drinking coffee or drinking sodas, Mountain Dew, Pepsi, and slowly cut back on how much you are drinking. I want to say caffeine is legal, it's not illegal, it's a normal drink that we all take every day, but it could be dangerous when taken in very high quantity over a very short period of time. So you need to look out for it. You can use it to stay active and alert, but don't drink too much. And if your sleep is being affected, don't drink coffee after 12 midday. That way you can have a good night's sleep and you can do well. I want to thank you again for tuning in today on Dr. Gilead Show. Thank you for the contributions, everyone that contributed. I hope we were able to answer the questions that were posed. I want to encourage you to tune in again next week, Thursday at 1 p.m. We're still staying on talking about substance abuse, substances that people get addicted to. Tune in next week, Thursday at 1 p.m. on Dr. Gilead Show, and you can look through this again, listen to it again on YouTube. Google Dr. Gilead Show, and you can listen over all the topics we've talked about in the past. And you can get on our Facebook page, and you can also listen, or you can call in on WBGR Radio on 301-429-9247 during any of our shows. I'm your host, Dr. Theo Oswala. You can reach me on my office, 301-577-9111, 301-577-9111, or you can Google me and you can come to my office if you have a need or any help with your mental health. Thank you very much for tuning in today. We'll see you again next week, Thursday. Thank you very much. Bye-bye.